Well, with running season kicking into high gear now, you want to make sure that a little ache or pain you feel now doesn't turn into something more serious. Orthopedic surgeon Dr. Jon Hyman joins us now to talk about running injuries this morning. Good morning, Dr. Hyman.
Good morning.
How do most people get injured as they start off their running season?
Well, the issue is that many people tend to jump back into their running regimen with a little bit too much intensity or too much fast-paced running and not making a gradual transition, which can lead to overuse injuries and sometimes strains and lumps and pains that we don't really want to deal with.
What are the most common injuries that you see?
Well, with overtraining and rapid pace running, typically people develop things like shin splints or blisters. You can even get into a situation where your bones can get weak enough where you develop stress fractures.
What kinds of things can you do to prevent those kinds of injuries?
Well, generally we advocate that people, one, begin gradually so that they start their training regimen at a slow pace and slow distance. Secondly, that they warm up and stay very loose and limber before they get out and actually start their running program. And of course, hydration and adequate nutrition. You
know, so many people, the tendency is to jump right back in where you left off. And as you say, that's not always the best thing to do.
That's right. Sometimes in our off season or in the downtime, so to speak, we put on a few extra pounds. We may be even cross-training in other sports or other activities that put stresses or strains on our tissue that we're not necessarily used to. So it's important to give yourself adequate time to get back into it. Our tissue has some elasticity in it. So much in the same way chewing gum can be very brittle if you pull it too quickly, but if you pull it slowly, it can stretch and elongate. It's important to let your tissue stretch and warm up and acclimate to your new training program.
Now, we talk about getting a good start. I've just recently learned that stretching afterwards, and my coaches always said stretch before you run, right? We're learning now that stretching afterwards is just as important, if not more important.
That's right. Stretching afterwards is important, and so-called cooling down is important. And shoe wear is also one thing I want to mention, too, is that proper shoe wear, whether it's orthotics or insoles such as these. Running shoes don't always come with the right ones for your feet, so you may have to get extra insoles or orthotics or heel cushions or gel pads to provide extra cushioning, because a lot of runners will develop problems in the heel pain in the Achilles area, and it's important not only to warm down and cool down, but also to have proper shoe wear.
Yeah, I would think it would be good to have a good fit, and a lot of sporting goods stores, you know, they're able to look at your feet. They even have machines that you can stand on to tell what is it called, pronate or...
Exactly, pronation, supination, or where they've got flat foot and a high arch, a wide arch, and they've got pressure sensors that can actually measure you and likely get you fitted with the best shoe for your foot.
I would imagine that there are a lot of people who don't even know that they're wearing bad shoes.
That's right. Some people just pull the shoes out of the closet from last year or 5 years ago in some cases, and they don't necessarily have the proper mechanics. You know, if you're in another country and you run barefoot or you're a Kenyan marathoner, it might not be as much of an issue. But for those of us here, it's important to make sure that your shoes are updated and properly fitted.
If you're just starting a running regimen, what would be good advice in terms of mileage or just building up?
Well, we always talk about gradual transitions, so certainly short intervals with a slow progression in pace. Sometimes people even make a transition between walking and jogging and then progressing to running or interval training. You
know, a lot of kids have shin splints this year when they're starting tracks. I know my kids are doing track and they've got shin splints all the time. Anything real quickly that you can tell us about treating that?
Well, shin splints mainly respond to rest, also ice and heat, and sometimes the contrast of ice and heat. But shin splints can progress to compartment syndrome in the muscle where the pressure builds up, or even a stress fracture. So if it's not going away in a short period of time, definitely consult with your physician.
All right, that was always my problem too in track. Dr. Hyman, good to see you this morning.
Thank you very much.
Thank you, sir.